As markets continue their downturn, coronavirus also taking a toll in human lives across the globe. And joining us now to discuss is Dr. Ian Lipkin, Columbia University professor and director of the Center for Infection and Immunity at the university's Mailman School of Public Health. Dr. Lipkin, you yourself were in a 14-day self-quarantine after traveling to China to advise local health officials on the coronavirus outbreak. I imagine you were still in contact, obviously monitoring what's happening over there. The narrative is that it is better in mainland China. Would you confirm that and agree with that?
I do agree. We're seeing many more cases now outside of the country. So the acceleration that was present early on is over.
And so, Doctor, when you look at the number of cases outside of China that have come up in recent weeks or recent days even, what concerns you about those outbreaks in terms of how many more there may be than we are currently aware of and what it says about the virus itself?
Well, the greatest concern is that people have the capacity to transmit infection even when they don't themselves have any symptoms of disease. So this means it can be percolating below the surface, and then someone who is susceptible to infection, who might in fact become very ill, becomes exposed. That's in fact what happens. And then we have morbidity, mortality, hospitalizations, other costs.
Dr. Lipkin, Brian Chung here. So I understand that you have worked with the World Health Organization in the past. I'm wondering how you're judging the current response to the spread of the coronavirus around the world from the World Health Organization and then domestically here in the United States by the administration, by the NIH, by the HHS. How do you judge their response to this? Is there any reason to think that it is contained, as we've heard some members of the administration say?
Well, starting with WHO, they've just released a report. It's very comprehensive, and I recommend it because it not only summarizes the state of what we know about this virus, how it originated, where it might go, but it also specifically discusses the response within China. And the feeling is that the Chinese government responded rapidly and forthright and transparent fashion, and that as a result of sacrifices there, some of what might have occurred outside, we've been spared. Now, when you contrast this with what's happening inside the United States, I'm concerned about what I view as to be some complacency and the suggestion that we're ready for everything and it's all going to be fine. I would like to believe that it's all going to be fine. I certainly hope that that's the case. But we have unfortunately lost much of the infrastructure that we built under previous administrations. So we have an underfunded Centers for Disease Control. The National Institutes of Health always needs more funding in this way. And I would like to think that experts would be advising the public on what should be done. I know the people who've been speaking out at the CDC, Dr. Shukett and Dr. Messonnier, who work underneath Dr. Redfield. They're superb professionals, and they understand the risks and what needs to be done. I'm hoping that higher levels of the administration will also report in this way.
So when you talk about complacency, I think there are some corners out there that are worried about complacency, and then there are people that are worried that there's just panic and people are preparing too much already. People talking about having 2 weeks of canned food, people wearing masks around. How far do you think the average American should be going right now to protect themselves against an outbreak? Do regular people need to do anything right now besides wash their hands well?
Well, I think extremism is inappropriate either direction. I mean, the things that we can do to reduce risk, as you've said, are washing your hands frequently, not touching your face, not touching your mouth and nose in particular. I use gloves on public conveyances and social distancing. I think handshakes are something we should avoid for the present. I think that, kisses on either cheek are probably something that we should avoid for the present. We need to work with what we have, which at present is containment. Vaccines are, at best 9 months away. The challenge is not so much in making a vaccine. That I think we can do quite easily. but we need to test it for safety, efficacy. It has to be produced and tested under good manufacturing practices, and then it has to be distributed. And all of this is going to take months. It's not something we can simply roll out rapidly.
Dr. Ian Lipkin, director of the Center for Infection and Immunity at Columbia University. Have a good weekend.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.